Welcome back to Liquid Lunch.
There's that liquid lunch we were talking about. Oh, way, huh?
Well, that's just a precursor of what's to come as Stu and I get older and
Yes.
start to think about where we're going to spend our declining years. Declining years. That's not a good.
It's kind
It
of
doesn't
negative.
sound good.
A negative connotation.
No,
Declining
it's like
years.
it kind of. I saw Logan's Run.
Yeah,
It's
great.
probably like that.
Yeah.
It's what do you call carousel?
Carousel, yeah.
Well, I'm here to help slow that decline.
Yeah, exactly. It's still green. It's still green. It's not red yet.
Well, we're here with Perry Martin, president of Caring Hearts Ontario.
Thank you. It's great to be here.
It's great to have you here. We're not, we are joking, but we're
But
not
we're
joking
not.
because really this is a huge need that, I mean, I've thought about it. It's just going to be incredible what's going to be happening.
Yeah, look at our population. You know, I don't know what the real numbers are. I heard a few years
Well-
back there was like 60 or 70% of us in the next 10 years are going to be 60 years or older.
by 2030 it'll double.
Wow.
1 in 5 people you'll meet
Yes.
on the street will be a senior.
A senior, yeah.
So that population, they call it tsunami, I guess, is coming quickly.
But now, classified senior, is that 55 and up, or is it still
I'm
65
classifying
retired?
as 65 and up.
There you go.
Yeah. So
Okay,
Yeah.
good. So we've still got a few
We got
years
time.
left to make our fortunes.
3 more, wait a minute. Yes, exactly. Now, and what are we going to do for us aged populists coming
Well-
up in the next 10, 20 years?
ideally, we'll have the resources in place to allow you to live life better at home.
Right.
Keep you out of a long-term care facility. Keep you out of hospital for sure.
Nice.
And so that's really what we're all about at Caring Hearts.
Which is really important because that's what people want anyway,
You
right?
bet.
That's what people want.
They want to
and
live at home.
and it's cheaper
Yeah.
anyway
Yeah.
for everybody involved.
You know, Hugh, you've hit on the magic statement. It is. It's much more cost effective. And all, the health planning in any health system anywhere now is what can we do to keep people out of more costly healthcare settings, like long-term care facilities, like hospitals.
It has to be preventative.
It's gotta be.
Rather than curative, because we've been
Right.
doing this for a million years. Let's fix what's hurting rather than let's not make it hurt at all.
Truly.
And my father, he just passed last November, and he, till 90 years old, stayed at home. And even the last 3 weeks that he was in the hospital, every day was, get me
Get me
out of
out,
here.
yeah.
I do not want to die here, knowing what was going to eventually happen. But he said, I went every conversation, am I going
Well,
home?
the type of services we provide aren't as glamorous as heart surgery or major interventions
Sure,
like that. But
sure.
the benefit that you accrue from these earlier interventions, just helping people in their homes, I think there's a big payoff at the end of it. And as you said, Stu, I think just the mere fact that your father was able to stay at home till 90.
Yeah.
I mean, that's the ideal, frankly, if we can achieve that.
So let's talk a little bit about Caring Hearts Ontario
Sure.
because I guess it's new to Ontario, but not
It is.
new
That's
overall.
right. This is we're new here. We're starting. We're a sister of a larger home care operation in the U.S. that's been around since 1997, and it's located in 500 communities across the U.S. It's called Home Helpers. I took a decision to invest in the rights here and to bring it north to Ontario because I feel that there's a real need for more home care.
It's
here.
timely, there's no doubt.
And I looked at the system extensively and felt this is a good system. It will work well here and thought this is a great opportunity for me and hopefully I can benefit the sandwich generation people and seniors and offer a real
And this is
needed
more than
service.
just seniors, because you do
Absolutely.
new mothers, recuperative, things like that, right?
Yeah,
But-
if I was tossing a slogan at you,
Yeah.
Stu, I'd say it's, we have the 5 profit centers.
Okay.
Right? We have the home care, absolutely.
Right.
We and that helps seniors, and we have new mothers who might not be able to get around quite as ably in the home.
Sure.
There's people recovering from surgery. Again, there's
Absolutely.
a challenge to function in your home, and the disabled, the more chronic conditions. And then we offer a service we call it Direct Link, and it's an emergency response system. And so the individual wears a pendant or a bracelet,
Yep.
has a button, and
Yep.
if they're in distress, they hit the button, and a signal's sent to a dispatcher who can communicate and offer assistance.
Yeah.
So we think that's pretty valuable.
In my father's, again, in his case,
Yeah.
on a couple of occasions,
Yeah.
he were similar. It wasn't the same product, but it was a similar.
Had a pendant,
Had the pendant,
which is pretty
Yeah,
key
yeah.
because you can carry it everywhere. When you're in the
Exactly.
bathtub, you can just
Yep.
hang it up and it's there.
Yep.
Yeah, yeah, it's great.
So let's talk a little bit about the system and
Sure.
what is unique about Caring Hearts that got you interested enough to bring it to Ontario. There must be something special about it
Well,
that you saw.
I think, one, it works. It's a good system. The other thing, what really attracted me to Home Helpers Caring Hearts was the fact that they had direct link as well. I think when you twin the home care side with the emergency response side plus medication management, which is also embedded into the direct link system, and it's a little system that reminds people to take their medication. It's a great way, again, to keep folks out of hospital.
Mm-hmm.
So I thought that those were truly unique features that separate us a bit in this marketplace.
Mhm.
I felt like this system can work very well here.
Now, is it more than just reminding people when to take? Because I've seen horror stories where people just get maybe they're seeing more than one doctor, and they've just got a regimen of
Right.
drugs that they're taking that is, there's interactions going on. People aren't aware of them.
Yeah, the system's designed to dose too, so it will prevent those type of interactions that can really create a serious health issue. So
Mhm.
it makes sure that there's absolute compliance with the medicine you're taking, not just when you take it, but what you take.
Okay. And now, how did you get into this? What were you doing before that led you to this
Well,
particular path?
I was actually working in government. I've been about 20 years in healthcare, working in government and in politics. I was, at the time, I've worked for 3 different ministers of health, chief of staff to 3 different ministers of health, a couple here in Ontario, 1 in Saskatchewan, and I've done a lot of health consulting. And for years, I've wanted to find a good opportunity to launch a health business. I wanted to have my own thing
Mhm.
in healthcare. And I always felt that home care was the best opportunity because of the natural demographic opportunity
Mhm.
and the fact that all health systems are slowly recognizing you got to invest more in in home care
Mhm.
because you get more bang for your buck with every dollar you spend in home care than in most other health interventions. So I just felt there was a real opportunity there.
Okay. So now, where does it go? Where does it stand in Ontario right now? Where does Caring Hearts stand, and what's the game plan for moving forward?
We're really in our infancy at this point. We've got lots of good territory still available. We've just sold a franchise north of Toronto in King City. So that's kind of our launch franchise. I myself will be buying a franchise from myself next month, I hope, and I intend to set up operations in Toronto.
So there's an opportunity for people to get in touch with you
bet.
and start to provide the
Please.
service in communities all over the province.
Absolutely.
And who are these franchisees? Like, what qualifications do you need to do a startup with
You know,
Caring Hearts?
to me, if you're looking at the ideal profile of a franchisee, it's someone who is at the point in their life where they really they have a dream of owning something and want to own a business. And they've got a real sales background, but also they want to do something that adds value. And I think when you can find those 3 ingredients, you've got the right franchisee. So, in short, I don't think you need someone who has tremendous expertise in home care.
Yeah, like
That's
nursing
really-
backgrounds or anything like that. You don't.
Not necessary.
Okay.
We do all the training and teaching. We've got the hands-on support every day. So we're going to help with that. Really you need someone who is a bit of a go-getter, wants their own business, and wants to work it hard.
Passionate.
Yeah, and has that sense of, hey, I love what I'm doing here
Right.
because I'm really making a difference in
Helping.
people's lives. Yeah.
Now, I've just got a question about, we kind of joke about it, but I'm not sure where things are going to be heading in terms of, it seems to me that the public health care system in Canada, whatever you want about it, it's moving inexorably towards some sort of a mixed system or towards privatizing at least parts of the system. And when that when that issue comes up, it also raises the question of, where's the money going to come from to
Right.
pay for the services? Because we've gotten used to a public system where everybody's got access to the care,
Yeah.
right? Um,
You're right. I'm really glad you raised that, because it's, the healthcare system is under some stress financially. Absolutely.
It is.
Because we know 46 cents of every dollar the government spends, the government goes to healthcare. We also know that home care as a health service is not an insured service. So there's always been a mix of private pay, private delivery in that system. And I wouldn't think that that's going to change a lot when you look at the numbers currently. I think in Ontario last year, there were about 20 million visits, home care visits, that were paid right out of pocket. So there's a lot of private money in home care because, we want to look after our loved ones to keep them functioning better at home. So, there's waiting lists for this type of service in the public system. So you don't want your loved one going without. So there's a good deal of private pay right now in the home care
So
system.
this is where you're saying this is where Caring Hearts fits in. It is to help pick up that slack where the public system can't do the job.
Well, if we can look specifically at home care, I think most of the money now in home care is really designed to get people out of hospital. The ones who are in hospital beds who could really be treated outside of a hospital bed with more home care. So it's a heavier, more acute home care patient that the public money's going towards. So you could take your mother and father that doesn't need a lot of health care per se, but could use some help around the home. The waiting lists for that type of support grow exponentially as all the resourcing goes towards the heavier acute patients. And that's where we fit in. Absolutely. That's a type of home care we specialize in.
So
The
I'm-
type of home care that hopefully prevents your mother and father, your loved one, from having to go to the hospital.
Right.
Or go to the long-term
Or
care
prevent you from, in a situation like that, maybe you've got to take some time off of work to go look after them.
Oh, gosh.
And that's going to
Yeah.
cost you even more, right?
That's another great thought, because the burden falls on you as, the son, daughter, the family member. You've got to take a leave from your job. And we haven't yet reached the point where we have good government programming that really allows that to happen without some type of financial penalty to you to do that. I know there's been talk on the election campaign federally of some of the parties introducing a caregiver tax relief program, and that's really, that's a solid program, and I applaud that.
And that would be something, I guess, that would be able to help all your franchisees because they would be able to, in a sense, indirectly take advantage of those kind of tax benefits.
It may.
Yeah.
It depends on how they're designed, but if the money's both to the family person and also to them to actually provide that support to their loved one, it will help, absolutely. Yeah.
Okay, so now, as you've mentioned, it's kind of early days in Ontario, at least for Caring Hearts, and you talked about a couple of territories that may be spoken for, but there's lots of province to go around.
You bet. Yeah.
Are you targeting communities of certain sizes, or how are you defining the territories for the
Yeah,
franchisees?
it's a good question, Hugh. Generally, our territories are sized around populations of about 175,000. So, yeah. Say take a city like London, that would be a territory. You wouldn't want to put too many franchises in a small territory like that. But that's roughly what we're looking at. A city like Toronto, you can have many.
Sure, and
obviously.
it does come down to demand after a
You bet.
while. I mean, you could have two in London.
Sure.
If,
Yeah.
If
Yeah.
need be, but Toronto, I mean, surrounding neighborhoods,
Yeah.
it's wide open.
Yeah, and we want to offer that exclusivity to our
Right.
franchisees.
Sure.
We think that's very important.
Sure.
It's we don't want to have forgive me for saying this, a Subway on
Starbucks
every
or a
corner.
Subway. Yeah. Tim Hortons to be Canadian.
Correct. Yeah.
Now, should should I even ask the question what price range the
I don't mind at all.
franchises
Yeah,
are?
I'm glad you do. It's very affordable, I think. We offer our franchises up at $34,900, and with that you can also get a direct link franchise, the emergency response system that I outlined. also is included into that package, which
Oh, okay.
makes it quite comprehensive. That franchise, Direct Link, alone is valued at close to $19,000. So
Wow. So that's
kind of 2 in 1.
Yeah, it is.
Yeah.
and as you say, it really is a growth area. As you said,
Absolutely.
I mean, the market. Do you have an estimate of what the market for this is today and how it's growing?
Well, as I mentioned earlier, 20 million paid visits in Ontario alone.
Mm-hmm.
So, and you got to expect with the aging of the population and the strain on the provincial treasury that number's got to grow.
Mm-hmm.
So the market's robust, there's no doubt. There's lots of room for providers in that space, and we intend to take advantage of that.
And I'm guessing too that Caring Hearts represents a level of I hesitate to use the word professionalism, but it's a systematized approach.
Yes.
Right?
It's, the beauty of franchising is it allows people to live their dreams to own a business, but they don't have to worry about the complications of all the startup issues you have in owning a business. So
Somebody's already made those mistakes and
exactly.
adjusted
It's a system,
accordingly.
as you mentioned, Hugh, and it's
Yeah.
got all the support you need from IT, scheduling, marketing, lots of creative marketing, and the ongoing support day to day. So
Okay.
it's
Great. Is there anything else you can tell us about it? We're going to give all the contact information, but is there anything we haven't asked you that maybe you want to make sure people
You've
know
actually
about?
been pretty good at asking all the right things, I think.
That's what we do here at That Channel. That's
Yeah.
we're getting ready for retirement.
Doing our due diligence.
Extremely impressed with your research department. This is
Well, we're impressed too.
But please feel free if you ever need information on this for your loved ones or whomever.
Okay. Yeah. So people may want to take advantage of the services, or people might just be interested in finding out about the franchise
got it.
opportunity.
Yeah.
What's the best way for them to get in touch with you?
Email me, pmartin@caringheartscanada.ca, and I'll give you a phone number, 647-405-4216.
Okay. pmartin@caringheartscanada.com.
.ca.
Yep. Okay. Perfect.
And the website is caringheartscanada.ca.
All right. We just put up the phone number as well, so
I see it.
people
It's up.
can
It's working.
see. It's a miracle.
Wow.
All right. There you go.
Terrific.
Okay. Great to meet you,
Well,
Perry.
likewise, Hugh and Stu.
Very
And
It's been a
pleasure.
pleasure.
All the best with Caring Hearts, and who knows, we may be calling you for maybe even a franchise opportunity.
Yeah, well, yeah. Mostly it'll be drooling on the phone and just looking for help.
I
but,
don't do life coaching, but we do offer some business coaching to our franchisees too.
Okay, great.
So,
Oh, that's
just
tremendous.
to trail on the back of your previous guest, we have
Absolutely.
an element of that too. So.
Great.
Perfect.
Okay,
All right.
thanks. Great
Thank
to
you
meet
very much
Thanks,
for
Barry.
having me.
All
Appreciate
the
it.
best
Enjoyed
with
it.
Caring Hearts. And I guess that's it for the
That's
show,
it for a
Stu,
Monday afternoon, yeah.
Yep. So,
I won't see you next week, but the
2
week
weeks.
after, yeah, I'll be back, sure.
and that'll be great.
Yeah, looking forward to it. And I'll
Well, unless you show up next Monday for Rose Reisman and some
Yeah, I might-
deep fried pickles.
might just sit on
Right?
the couch and eat a fried pickle or two.
All right.
Nice.
All right,
Great.
pal.
Okay, that's it for the show. Thanks everybody for tuning in. We'll see you tomorrow at noon for more Liquid Lunch right here on ThatChannel.com.